Checking in with Paul Gorman, president of the South Shore YMCA here in Quincy for a little status update, I guess, on how things are going at the Y. Hey, Paul, nice to see you again.
Good to see you, Joe. Thank you.
Oh, our pleasure. We chatted back kind of at the height of the pandemic when everything was really raging, and thankfully it's a better position today. But how is the Y doing?
Yeah, so, when we were from March until the end of June, we were closed. And as we talked about the last time I was on, that we conducted emergency child care for essential care workers, food pantry, which quadrupled in need, and we turned the Quincy Y into a homeless shelter, and plus we delivered meals to seniors. So the homeless shelter, working with Father Bills, that's now completed since we opened up the Y. Emergency child care has turned into now our regular child care. And our food pantry needs still has quadrupled. That hasn't gone down at all. So that is still, we're still working, overtime sort of at Germantown to provide that service to folks who need it. Interesting enough, when we look back at the time we were closed at the height of the pandemic, we didn't have any cases. When you think about emergency child care for 80 children, for essential care workers, those were doctors, nurses, children, firemen, police, children, supermarket workers, so those are higher risk, and we didn't have any. And it was less restrictive than it is now for the kids going back to school. We were allowed to have 20 kids in a classroom, mixed ages with 2 staff, and no face masks were required in that. We just didn't let parents into the building. And but the way we worked with kids and our cleaning worked really well. We see over 1,000 people at our food pantry a week. No cases there. Again, we always wore face masks there and working with those folks. And then with the homeless shelter, we had about 40 or 50 folks 24/7. No cases there as well. We have a professional cleaning company that has always been part of the Y, come in every single night. So the additional cleaning of our staff and all the procedures and protocols we put in place has really worked. Now, since we've opened up, we see, a small demand for our services. The Y is an organization that brings people together, and that's not what this is all about. For instance, in childcare, we're probably at about 30% of where we were before all this happened. And that's because some people are still unemployed. Some people found other childcare during this time. A lot of people still working at home, so they don't need it. So that's going to be slow to come back. But again, with all the protocols put in place, the guidelines by the state and CDC that we completely follow, since we've been open in July, no cases. So we know we're safe. Now that doesn't, statistically, there'll be a case somewhere, but all those protocols, procedures, cleaning, extra cleaning if that happens, and quarantining if that happens, we have that all ready in place. As far as regular YMCA activities coming in, we do see only about 10 or 20% of folks coming back. Almost 55% of our members have either canceled their membership or put it on hold. So that's been that's a big hit. In our activities in the pools, it's by reservation only. 1 person to a lap lane for those folks to get in there. Reservations maybe for a family to get a portion of the pool for themselves to recreate. Upstairs in the Health and Wellness Center, a couple of things that are happening. One, it's 14 feet in between people. So if there's 1 machine open, there's like 3 that are not in between for the spacing. We've spaced out other equipment. We are going through we lease our equipment, and our lease is up now. So we're ordering new equipment, but we're only ordering a third of what we had before. So you'll see the natural spacing up there now as well. We're working with the school systems, Quincy, Norwell, Situate, after-school programs. Some of those programs are going to be in schools. Some of them are going to be in the Y and some other spaces out there, which is, everybody knows that's been a hot topic lately, the after-school, where a kid's going to be if they're either remotely learning or there's a hybrid model. So we're working with those schools to help provide support for those families. We just wrapped up our camp season. We extended it out 2 more weeks because school was pushed out 2 weeks. So we just wrapped up that. We didn't have resident camp. We weren't allowed to have resident camp. So the programs that are really getting started, overall, most of the programs are very, very small. 2 programs that are strong for us right now. One is our down in Hanover at Emerson Branch. We have a strong tennis program for youth and adults. Tennis is a pretty good social distance program, so that works out well. And then our newest program, we've partnered with Powers Aquatics. It's to work with young families. So these are babies, I believe 6 months to just about 5 years, and their parent in the pool together with an instructor of learning how to swim. And, we're very happy right out of the blocks. We have about 1,500 folks, kids in the program for our fall registration. And again, I think that speaks to the confidence level of what we've been doing in the Ys, that they feel comfortable about coming to the Y. They see our procedures and protocols of cleanliness and social distancing. And, you would think, okay, if you have a new baby, you might be extra cautious. And we believe they are. They really came to look at everything before they enrolled in the program. The other folks coming back, we do have a lot of seniors coming back and a lot of people with disabilities in our partnership program. Again, we feel it's safe. We're taking all the safety precautions, social distancing, but they're coming back because a lot of them have felt isolated throughout this whole. So the socialization is an important part of it, as well as still to be fit. Mm-hmm. If the fitter you are, the better you can fight off this disease, whatever age you are. And, you want to avoid the large groups. And, we probably have, we have large buildings. Our childcare is separate in our buildings. But if you look at, we probably have a handful of staff, 5 or 6 staff in the whole building, and no more than 20 or 30 people coming in. So people don't have to worry about the crowds coming in. And but this is we're looking at it as the next year and a half into. We don't think everything's going to be back to normal really till 2022.
Yeah.
If you assume, depending on who you hear about vaccines, let's assume the beginning of the year, vaccine is out. By time it gets to everyone, it's going to be later on in the year, maybe into the fall, and then we'll see a rebuilding from there. So that's how we're looking at it. We're probably through August, March through August, we've probably lost about. I'm just going through the financials now, about $4 million. Really? And that's not the budget. That's real money. Yes. $4 million loss. And going into the rest of the year, we see about another $1.5 million of loss till December, and maybe up to about $2 million through the first half of next year until June. Now that's all we've projected out, because summer could be a big win for us if we're able to have resident camp and camps. Then we could break even for the rest of the year, and then we're back on track.
Okay.
So how are we handling the losses? Our fundraising has been strong. We continue to look to support from folks, our donors from the past. We did receive some federal PPP money, which still we're working with our auditors. We're not quite sure if that's going to be forgiven or just turned into a loan. So if it's a loan, yeah, that's still money that we have to pay back. If some of it's forgiven, great. That will really help us. And for the other loss, we'll be dipping into our endowment. And that's what our endowment is for. But we have to be careful that we have to watch every dime, because we can't dip into too far, because who knows if something happens later on. So we're really down. We had 1,100 full-time and not full-time, 1,100 employees, full and part-time last year at this time. This year we have about 175.
Wow. Okay.
So if you walk in, it's skeleton staff. We've really cut down on all of our overhead. We were leasing some office space for our back offices. We're now out of that. So my office is now in a Y branch. We're kind of scattered around. So we're really trying to save wherever we can. And with the staff we have now, we want to retain, because hopefully we know that this staff can ramp back up to where we were. We have the experienced staff all around, but they're doing 2 and 3 jobs right now.
Yeah.
So it's there's certainly a loss of jobs. There's a loss of money, but where we are right now, we're very confident we can meet the needs of the community, help back, whether it's school, early learning, school-age kids, folks that want to get back to being fit and healthy and abiding by all the social distancing protocols here. And but it's going to be incremental, small increments over the next year. We won't see the big growth that we're used to here at the Y. Over the past 10 years, we've doubled in size.
Right.
And now we've just gone back more than 50%, and so we have to rebound and go back. And we understand there are a lot, unemployment in Massachusetts is very high. And we want to make sure that people know about our financial assistance programs. No one's turned away based on the inability to pay. So we welcome them to come in if you're unemployed, or your job has been cut back, or your salary's been cut back, and you need that. That's what we're here for. So we want to make sure that we accommodate all of those folks in our lives.
What I'm struck by, Paul, and just speaking with you this morning, is your steadfast commitment to the Y's mission and to the community, despite all of the hurdles and roadblocks that you've just pointed out. If I was speaking to somebody in the corporate world in the same situation, they'd be thinking Chapter 11 bankruptcy.
No, it's right now. It's so different when you're at a certain level. Well, for most professionals, you're looking at how do you grow, what's your next challenge, and looking forward. And that isn't in front of us. It's not going to be in front of us for another year and a half. And to use a sports analogy, this is just basics, blocking and tackling right now. That's all it is. And that's we had a senior team meeting the other day, and we talked about we have to find our wins differently, our rewards differently. And it's more day to day instead of looking out to the future. Because if you look out, you'll say, oh my goodness, we're not really going there. So the day to day wins are working even more closely with the folks that come in, that we're able to help anyone that comes in, the preschoolers, the school age kids, seniors, get to know them even better than we do already. And be here for them and work with other community groups that we can or need their help, or the food pantry. Those are all of our wins right now, and that's and it's day to day. Just take it one day at a time. How to go today? We've we just have to keep a handle on our expenses and look for those incremental wins.
What is the occupancy for the Y right now? Can you be at 100%?
As far as
members coming in, are you able to?
Oh, no, so it's still restricted to by the state 40%.
20%, okay.
40%. So, and we're only at 20%
Gotcha.
cost
Okay.
right now.
Okay.
Maybe 15%. So we're not even at whatever restrictions we have restrictions for childcare. We're not at that level yet. It's interesting. We talk about, how do you promote what we're doing right now or market? It doesn't matter, because this is all about confidence in folks, consumer confidence, our member confidence, our program participant confidence. If they're not confident about coming back, it doesn't matter what we do. So we have to understand that. We have to acknowledge that. And, so we're just trying to communicate with people, let them know we're here when they're ready. And we're going to do everything to ensure that they feel comfortable and safe in our facilities.
Yeah. Do you think it's a good thing that you developed the new building before all this hit, or not?
Oh yeah, absolutely. Because what the new building did, it helped us grow. It helped us build some of the reserves that we're now tapping into.
Okay.
And if we didn't have that, we would really be behind the 8 ball.
Okay.
A lot more. So when we build, our endowment has been. A lot of it has been from folks, donating to it or leaving, but a lot of it's just built, reserves for a rainy day.
Mm-hmm.
And, our goal, we never got to it. Our goal was to have 6 months expenses in there as an endowment. Well, since we've shrunk quite a bit, we might be at that goal. It's not how we wanted to get there. But,
gotcha. Yeah.
So now, as we tap into it, we're comfortable that the operational losses that we're going to have over the next year and a half, that we can absorb through generous donations that people continue to give. Mm-hmm. We're at the same level of fundraising that we were last year, which is great. Mm-hmm. People are stepping up, and our endowment, which is there to help with that. But it didn't come. It came with a lot of pain and agony as you downsize with all those folks that work for us. A lot of them for many years.
Yeah.
It's not easy when you're in a position, whether it's the CEO position or a program position, that you have to have these hard conversations with these folks, and they understand, but it's still painful, and so that's certainly not the most enjoyable part of the job and what's going on right now.
Sure. What are you hearing from your colleagues at other Ys and similar sized communities?
Yeah, so it's pretty similar, and I talked to some of my peers across the country as well, and we got hit hard early, so we had to do a lot of this early on, as far as furloughing and laying off and looking at what resources we had, and over the period of months, as things caught up in other parts, they were reaching out. Geez, Paul, how did you handle this? What did you do? I'm struggling, with making these tough decisions. So we share a lot. Unfortunately, Ys are Ys across the country, but we're a federated organization. So every Y association is independent. So mm-hmm. I'm independent we're independent from the Greater Boston Y, the North Shore Y. And although we share ideas, we work together, there's some consulting going back and forth, but when it comes down to resources, there's no secret pool of money out there that is handed out. It's all on us and our work with our board of directors and our staff.
Have you been able to use, this type of communication, virtual communication at all for any of your programs or fundraising or anything of that nature?
Yeah. So that's interesting. So for the times we were shut down, we had online fitness classes, like a lot of places did. Some were our own teachers, some, with some other Ys, we collaborated to get some of their programs. So we tried to have that in place. We did have a fundraiser at the end of August, a golf tournament. We did have at Pine Hills, which was helpful. It was about 30% less than we usually bring in. And it was a little different. We couldn't have a program, because we couldn't usually have a big shotgun start. Everybody finishes, you do some fundraising. You couldn't do that. So it was for those folks that just paid for golf, it was golf and then they left.
Okay.
We do have, you're probably going to ask me the date. I believe it's October 23rd. Our Taste of the South Shore is coming up. And don't let Mary Orn know, our Vice President of Development. She'll yell at me for not knowing this. It's coming in October. Yeah, more to come, and I'll get you the information. But it's always scheduled for March or April every year. Obviously, we postponed it to September, thinking that we could have it. Now we postponed it to October, and it's going to be a virtual event. Okay. And we're going to be working with a bunch of different chefs remotely, and people can pay to sign on and do the fundraising with, they'll do their dishes, and I believe Billy Costa is going to host it for the evening for us again. And so it'll definitely be different, and won't bring in the amount that we always did, but we need the fundraising. So it should be a fun, different event for folks to be involved with. I'll make sure I get you that information.
Okay, good. Yeah, I know it's one of your signature fundraisers. So instead of sharing, tastings, they'll be sharing recipes, I suppose.
Right. And we'll have a lot of the chefs right on online.
Sure.
Zoom.
Yeah, sounds good. When did you actually open up for your members, Paul?
I believe it was the last week in June or the first week in July, right around there.
Okay.
So we've had experience, and what we've seen with folks, you saw the people that really wanted to get back. So it moved up, but it's been relatively flat. We haven't had a lot of more people coming in. We expect a little bit more now that school's back in session and people are trying to get back to whatever normalcy is now. And some of it may be activities here. We see, a few more at-home parents coming in because we have kids in babysitting, so a few more kids in babysitting, and some of the programs starting up. But it's certainly not what it was. We used to have at each branch, not total, about 3,000 visits a day, so 6,000 visits a day.
Wow.
Right now we're averaging 600 to 800 a day. So 10%, 15% of people coming in.
Okay. So, the good news is no lines, no waiting for the machines.
No,
right?
exactly. Actually, it's great when you come in. You almost have personal staff, and you have someone. We ask you to clean up. We give you, if you go up to the Health and Wellness Center, we give you a bottle, for your own cleaning, and then after you're done, we clean. So it's a personalized service right now.
Yeah, exactly.
So if you want the attention, come on in.
Actually, that's a good pivot point to ask about membership. Rates are staying the same. Do you know? Or?
Yeah. We did talk about that, and I did look at peers, and what everybody talked about was, instead of changing rates, to expand the financial assistance, to go higher with it. Higher levels. It used to be at a certain level you qualified. So now the level's higher, to include more people in financial assistance.
Okay.
So to make sure that that's really out there. And we're just calling it membership for all. So sometimes people look at financial assistance as a handout. And that's not the case at all. It's just that's how we operate.
Mhm.
And so whatever you qualify for, you qualify for. And we want to make sure, that there are some standards we put in place, but we all know there are always circumstances that are outside the guidelines there.
Sure.
And those are just guidelines.
Yeah. Yeah. I'm really just struck by your optimism in the face of adversity, really.
Yeah, just like I said, just put your head down, take it day by day, and we welcome those. There are a lot of businesses that are doing well right now, and any support that they can help us with. For a number of our members who aren't comfortable coming back, they haven't canceled their membership. They're donating their membership every month to help support us. That's helpful as well. So, we'll get through it because the Y's been in Quincy for almost 130 years. So that covers a couple of world wars, a pandemic, and a lot of depression and recessions. So we're here. It's a little painful, and we have to scale back for a couple of years, but we're going to be here for another 130 years.
SSYMCA.org, I know, is your main website. And a good phone number, Paul, for folks if they want to give a call?
617-479-8500.
Okay. That's the Quincy Y, obviously. Yeah.
Yep.
Anything else you'd like to add right now?
No. I hope everyone out there is safe and healthy, and anything the Y can do to help, don't be afraid to reach out to us. It will get better, and we'll be here.
All right. Good to talk to you, and same to you and your family and staff. Be well, be healthy. And if we can help here at QATV, please reach out.
Great. Thank you, Joe.
You're welcome.
All right. Talk to you soon.
Bye-bye.